Welcome to Lister Hospital Treatment Centre. This video is a general guide to preparation for and recovery from your total knee replacement. This enhanced recovery pathway has been designed by the multidisciplinary team to help optimise your experience and outcome of your surgery.
Hello, my name's Stephen Tighe and I'm one of the hip and knee surgeons here at East and North Hertfordshire NHS Trust. If you're watching this video, it's likely that you're considering undergoing hip or knee replacement surgery. Hip or knee replacement surgery is performed if you have a painful, worn-out joint, and strategies such as weight loss, analgesia and physiotherapy have failed to significantly improve your symptoms. Please watch this video in its entirety, as it should help alleviate some of the worries or concerns that you may have about your forthcoming joint replacement surgery. The video should also help educate you about your whole patient journey. This is particularly important as we know that a better educated and motivated patient leads to a better rehabilitated patient. Whilst there are various subtleties involved in hip and knee replacement surgery, the basic principles remain the same. We replace part or all of a worn-out joint with a combination of metal, plastic or ceramic, known as a prosthesis. Your surgeon can discuss with you which prosthesis best suits your individual needs. In knee replacement surgery, we shape the end of the femur and the top of the tibia to accept metal prosthesis. This prosthesis replaces the old, worn-out section of the bone, providing you with a pain-free range of movement. Your involvement is essential to the success of your recovery. Active participation in the Enhanced Recovery Programme can help you get home sooner, get better sooner, and get back to normal function sooner. Good luck with your forthcoming surgery.
Prior to your surgery, you'll have an appointment with the pre-op assessment nurses. Preparing yourself and home environment for surgery is key to optimising your recovery. At this pre-op assessment appointment, you'll receive a therapy pack for you to read and fill out. It is vital that this booklet is completed before your surgery. Once completed, if the booklet indicates you need to call the therapy team, please do so at the earliest opportunity. This phone call, if indicated, is required so the therapist can identify any home adaptations or equipment needs you may have. Please ensure this booklet is brought with you into hospital. Please also watch the video titled Equipment and Social History for further information on equipment. Before coming into hospital, there are a few things you can do in order to make it easier on returning home. These things include ensuring walkways are clear of rugs and wires, place frequently used objects at waist height, prepare meals in advance, ensure a telephone is near your bed or your chair, place lights in dark hallways and ensure rooms are well lit. If you are provided with any equipment prior to operation, please ensure the equipment is in place. Prior to your surgery, you will be provided with exercises to optimise strength as able. If pain is limiting you from completing the exercises, please just familiarise yourself with the programme to commence post-operatively. Please bring the exercise sheet with you into hospital. Please watch the video titled Total Knee Replacement Exercises for demonstration. You should prepare the belongings you will need to bring with you. We do encourage you to wear your own clothes and footwear following your surgery. However, space is limited and therefore please minimise what you bring in. Please include well-fitting flat footwear, loose clothing, walk-in or dressing aids used at home, own medication, toiletries, your exercise sheet and therapy pack given to you by the pre-op assessment nurses, any small washing, dressing or mobility aids you may have purchased as per the small aids advice sheet. Please see the leaflet provided for places you can purchase these. Please arrange your transport to hospital on day of surgery and home on day of discharge in advance. Please note it is a legal requirement that patients are accompanied by a competent adult with access to a telephone should assistance be needed in the first 24 hours following surgery. For the first 24 hours, we advise you do not sign any legal documentation, you do not operate any electrical appliances or machinery, you do not use social media platforms. Please consider who can provide ongoing support during your recovery, including transport to and from ongoing appointments. If you have any broken skin, wounds, scratches, eye infections or other infections, you must contact the hospital prior to your operation. The number for this will be available in your booklet provided. Please follow all advice given to you at your pre-op assessment with nurses. Please refer to section 4 of the information booklet provided. It is important that you eat and drink to avoid dehydration. However, in the days prior to your surgery, you must avoid any alcohol, avoid heavy and fatty foods, do not smoke or use recreational drugs or vape. Please follow the fasting instructions given to you by your pre-op assessment nurse. These are evidence-based and must be strictly followed. Water can be drunk up to 2 hours before your surgery. If you need further support, please contact the unit before your admission. You should wash the morning of your surgery, but do not use any creams or lotions. The pre-op assessment nurses will advise you on any medical cleaning products you may need to use. You will receive a phone call or letter prior to admission informing you of your time and date. Please note the location of admission, as some patients will be admitted in the treatment centre and others may be admitted in the main tower block of the hospital. Following your surgery, the therapists and nurses aim to commence your rehab as soon as possible. This includes mobilising as soon as you are able to within the first 2 to 4 hours after your operation is finished. This will be in the form of exercises or getting out of bed with assistance from the nursing or therapy staff. The aim of therapy is to ensure you are safe mobilising, transferring on and off the bed, chair and toilet, and managing stairs dependent on your personal goals. You'll also be advised on washing and dressing techniques, potentially using the aids listed in the therapy pack to maximise your independence. It is important that your exercises are completed in between therapy sessions 4 times per day for optimum recovery. Recovery is greatly enhanced in patients who are proactive with regular exercises and self-motivated with their rehabilitation. Information regarding discharge can be found in the information booklet you were provided at clinic. In summary, you must be medically stable, mobilising safely and independently with appropriate aids and required equipment and social support in place at home. As part of the enhanced recovery pathway, please note patients are discharged as soon as this criteria is met, which can be as soon as the day of surgery. In some instances, you may be transferred to the discharge lounge while you wait for your transport home. At discharge, your therapist will talk to you about what to expect in the coming weeks and how to progress your mobility at home. A follow-up therapy appointment will be arranged for you at an outpatient physiotherapy clinic close to home. The clinic will contact you via phone or letter to inform you of the date and time of this appointment at approximately 2 weeks following your discharge home. At 2 weeks following your knee surgery, you should see improvements in your mobility and function. This may include starting to mobilise with one walking aid indoors, starting to mobilise short distances outdoors, be independent or requiring minimal assistance with activities of daily living, improving your knee range of movement and strength. You will be seen 6 to 8 weeks post-op by your consultant or their team to monitor progress. You may also require community services such as district nurses, but this will be discussed with you upon discharge. For clip or stitch removal, the nurses will inform you of the date of removal, whether this will be at your GP or community nurses. As you will have discussed with your consultant when deciding on surgery, the purpose of surgery is to primarily help reduce your pain. Mobility and physical performance varies between patients, but often improves with increased compliance with exercises and therapy. At 2 weeks following your knee surgery, you should see improvements in your mobility and function. This may include starting to mobilise with one walking aid indoors, starting to mobilise short distances outdoors, independent or requiring minimal assistance with activities of daily living, improving your knee range of movement and strength. When progressing to one mobility aid, the stick or crutch should be held in the hand opposite to the operated leg, where possible. You should then progress your mobility to unaided when you feel ready and safe. You should follow your normal routine at home, building up your tolerance of your tasks daily. Please bear in mind that this is a rough guide and varies between each patient. You should consider your mobility and level of function prior to surgery to gauge a realistic goal. Once you no longer require your mobility aids, such as a relator frame or elbow crutches, please return them to any of our East and North Hertfordshire sites. Further videos you may find useful are listed below. Thank you for taking the time to watch this video.